It's a procedure that has only been done a few times around the world. And as News 4's Marcella Lee tells us tonight, doctors in Colorado are now performing the life-saving technique.
Well, since it went pretty well, I guess it feels pretty good.
Karen Frederick has a new liver, but unlike most patients who undergo liver transplants, Karen did not have to wait for someone else to die. Karen's sister flew in from California to donate part of her liver.
And I've never once ever had a second thought that I made the wrong decision. Never.
Christine Larson wanted to give her sister a second chance at life.
How do I ever thank her? Or show her enough appreciation.
On Wednesday, doctors removed more than 50% of Christine's liver and used it to replace Karen's failing liver. Both women's organs should regenerate to full size in about 6 weeks. A similar surgery has been done from adult to child, but doctors only need a small portion of a liver for that procedure. Removing more than half of a liver is much more complicated.
There's a lot of blood vessels, and that's one of the major concerns of major liver surgery is the blood vessels and the possibility to bleed during this surgery.
Doctors say Karen might not have survived another year without a transplant. She has hepatitis C, and the waiting list is long. About 150 people in Colorado are on a waiting list right now for a liver transplant. Doctors hope this new technique will help save more lives by freeing up more space on the list.
Now to tell us more about this operation is Dr. Michael Wachs, who's one of the transplant surgeons from University Hospital. Tell us just briefly in people language how this works and why it's so unique.
The doctor's pager is going off here. You're very important.
Hold it just a minute here.
That's okay.
Okay.
No problem.
The reason this works is that we're able to remove half of the liver from the living donor and transplant that into the recipient, leaving both patients with enough liver tissue to function.
Can you put this in perspective for us? How important is this? How significant is that this has happened in Colorado?
Well, we think it's important not only for Colorado, but for the rest of the country as well. There's about a 10% death rate on the waiting list for liver transplants. So if everybody who was eligible to donate a liver would, when they died, were to do that by signing their donor card, there wouldn't be an organ donor shortage. But because there is, we think this is going to be a big step towards helping to solve some of that donor crisis.
And you were saying a little bit earlier that this is kind of the next step. They've done adult-to-child liver transplants where you've taken part of the liver and inserted in the child. But this is adult-to-adult, and that's why it's so unique.
That's right. We, about 6 months ago, performed one of these operations at Children's Hospital where we took in a portion of the father's liver to give it to a small child. And that's done fairly routinely around the world, probably 1,000 times. That's been done in the last 10 years. This is the next step where we do a little bit larger operation in the donor, taking half of the liver to give to the recipient. And because it's from adult to adult, I think it'll go a long way to addressing the donor shortage in the adult population.
So we're seeing some video of that. And can you talk a little bit more about how the liver actually regenerates? You give it some tissue and then it regenerates from there?
Right. The amount of tissue that we gave the recipient in this case was about half of what she would have been born with had her liver not become diseased. And over about 6 weeks, the half of the liver will regenerate to full size.
In 6 weeks?
In about 6 weeks. Now,
what about side effects? Are there some special ones that you have to watch out for?
Once she gets through the initial surgery, she's like any other liver transplant patient, which is there are side effects to the medications, but most liver transplant patients will go on to live a very normal life. Most people go back to work. We have people who climb mountains, run in marathons, and patients are very active after liver transplant.
That's gotta be exciting. Talking a little bit more about how easy it is to become a donor. It's not very difficult, is it?
No, all you really need to do is talk to your family members. There's an opportunity on your driver's license to sign that you wish to be an organ donor, but if all you really need to do is let your next of kin know that in the event that something unfortunate were to happen to you, that you would wish to donate your organs, and they can carry out your wishes.
Do you see a day in which this kind of thing will become routine enough where maybe the liver problems that we've been experiencing and are now will become a thing of the past because we'll have this transition set up?
That's our hope, is that if we do this often enough and get good results, or at least if the results are as good as standard liver transplant, that we can prevent people from dying on the waiting list. That will be a safety gap or a safety net for those people.
You have to be excited about this.
Very exciting, yeah.
Wow, what a breakthrough. Great. Well, thanks
Thank
for
you.
being with us. We appreciate
Dr.
it.
Michael Wax. Thank you.
Thanks
Awfully
for having
early.
me.
We'll let you get back to your page.
Thank you very much.
Answer
Thank
your
you.
phone page there.